Due to hospital visitation restrictions, nurses in Western Mass have become important liaisons between patients and their loved ones. Western Mass News reporter Baystate Landaverde spoke to one local nurse from Baystate Medical Center about how she's there for families through virtual visits.
You're the last voice they're going to hear. You're the last hand they're going to hold.
Virtual hospital visits have become the new norm amid the coronavirus pandemic. Jasmine Davis, a registered nurse at Baystate Medical Center, is one of the many healthcare workers who have become the sole connection between patients and their loved ones. The hospital currently has 75 iPads that allow this communication through the Jitsi Meet app.
A lot of our patients' families, sometimes they will have a specific time that they would like to set a meeting or an appointment per se to meet with the patient. Other times it's just if they call the unit and say, hey, I'd like to see them if this is available, we use it right away.
Davis, entering her second year as a nurse, never imagined taking on such a vital role in connecting families through a pandemic.
With the connection of using the Jitsi and the families and the patients, it's been such a heartwarming experience for them. It's very emotional at the time. A lot of family members, they would cry.
Davis tells Western Mass News holding these FaceTime calls can be emotionally and mentally hard, but she is very fortunate that she is able to help patients through these hard times and assure them they are not alone.
I think they appreciate it. I think it's a very emotional moment because I'm there, I'm rubbing their head, I'm holding their hand, and even though they can't, the patient person, even though they can't talk, even though they can't move, you're still there. It's almost like you're being the physical presence for the family.
And for the Davio family, these virtual visits are a driving force in keeping them connected to their family member, Richard Davio, who has been at Baystate Medical Center fighting COVID-19 since April 11th.
They are very accommodating, and I'll tell you, it has been our connection to Rich, and the only way that I think that we've been able to stay sane and stay connected during this is to actually see him. It's been so important for the family.
In another case, the virtual visits helped connect a married couple, both in the hospital fighting COVID-19.
So I had her FaceTiming her husband that was actually down the hall, and it was such an emotional thing. She hadn't seen her husband. They were both quarantined. Now they're both in separate rooms. And that was just an emotional thing for her, and they loved it.
As for safety precautions, staff wear personal protective equipment to ensure everyone's safety. And the iPads are disinfected after every use.
This device allows them to talk with their family and not put themselves at risk of contracting the virus.
Davis tells me the goal is for Baystate Medical Center to continue this program even after the pandemic is over. For Western Mass News, I'm Baystate Landaverde.